Let's talk about something a lot of us have probably used, eye drops. Specifically, a very common and powerful type that, for some people, hides a pretty serious and unexpected risk.
You know, we trust medicines to solve our problems, right? But what happens when the cure itself might actually create an even bigger one? That is the question we are going to unpack today, and it all revolves around that tiny little bottle of eye drops.
So our story really starts with a particularly nasty allergic eye condition. And this isn't your typical springtime hay fever. It's way more intense. It's called vernal keratoconjunctivitis. But yeah, let's just call it VKC.
And you can see here just how bad VKC can get. We are not just talking about some minor irritation. This condition can escalate to the point where the inflammation makes simple, everyday things incredibly painful and difficult to do.
So to break it down, VKC is a chronic thing. It keeps coming back, and it affects both eyes. The symptoms are just brutal. Really intense itching, a painful sensitivity to light, and serious redness. For anyone going through this, getting relief isn't just a casual wish, it's an absolute necessity.
So naturally, you need a powerful fix. And that's where these come in. Corticosteroid eye drops. They are the absolute go-to treatment because they are incredibly good at calming down this kind of severe inflammation.
And just how common are we talking? Well, look at this number. A whopping 85% of patients with VKC use these corticosteroid eye drops. That is a massive majority of people all relying on this one kind of treatment.
So how do they work so well? Well, think of the body's inflammation process like a flood starting in your house. Most drugs are basically just mopping up the water on the floor, but steroids, they don't mess around. They go straight to the source and shut off the main water valve. They stop the whole cascade before it even gets going, which is why the relief they provide is so incredibly fast and powerful.
But, and you knew there was a but coming, this amazing solution has a hidden risk. For a certain group of people, this hero of a treatment has a bit of a dark side.
Yeah, a potential cost that, if nobody's paying attention, could be far worse than the original allergy. And this is where our story takes a really critical turn.
Okay, so the whole issue comes down to a group of people we call steroid responders. This isn't an allergy to the medicine or anything like that. It's actually genetic. For about a third of the entire population, using steroids causes the pressure inside their eyeballs to start creeping up.
And this diagram shows you exactly what's happening. The steroid medication can actually start to clog the eye's natural plumbing, its drainage system. It's just like your sink getting blocked. Fluid can't escape, so the pressure builds and builds and builds. And that pressure can permanently damage the optic nerve, which can lead to losing your vision.
Now, this isn't just some theoretical what-if scenario. Let's look at some cold, hard data from a study that was done at Lusaka Eye Hospital. It really shows how real this danger is.
Here it is, the key number from the study, 22.3%. That's the percentage of VKC patients on steroids who developed dangerously high eye pressure.
So to put that in perspective, that means about 1 out of every 5 patients in the study ended up with this serious complication. That's a really significant number. This table just lays it all out in black and white. Take a look at the median eye pressure. Before steroids, it was a perfectly healthy 15. But during steroid use, it leaped all the way to 28. That's nearly double, and well into the danger zone where damage can happen.
And if you're a visual person, wow, this chart just says it all. The green box on the left, that's the normal baseline pressure. The red box on the right, that's the huge jump to the peak pressure during treatment. The data here it's just undeniable.
Okay, I know that sounds pretty alarming, but here's the good news. This risk, while it's very real, is also very manageable. It all comes down to being aware of it and having proper medical supervision. Let's just walk through a real-world example. So there was this 23-year-old student with VKC. He gets prescribed a standard, potent steroid. But then, at his 4-week checkup, his pressure had spiked from a normal 17 all the way up to a risky 25. The doctor caught it right away, stopped that medication, and switched him to a milder, soft steroid. And guess what? 2 weeks later, his pressure was right back to normal. No harm done.
And this is the key to how they manage the risk. You see, doctors have different options. The hard steroids are powerful, but they stick around in the eye for longer, which increases the risk of a pressure spike. But soft steroids are designed differently. They get in, do their job, and then break down really quickly, which makes them a much safer option for people who are steroid responders.
So, what's the big takeaway here? It's this. Steroid eye drops are powerful, important medicines, but they absolutely carry a real risk for some people. The good news is that danger is totally manageable, but only with the doctor supervising and with regular pressure checks. And that brings us to maybe the most important point of all. You should never, ever use someone else's steroid eye drops, or use old ones, without a prescription and a doctor's okay.
This all leaves us with a pretty interesting final thought, doesn't it? This story is such a powerful reminder that in medicine, there's often way more going on than meets the eye. It really makes you wonder, what other common treatments, what other miracle cures might have hidden complexities that we're only just beginning to understand?